Welcome to Issues and Answers with your host, Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host, Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. If you dial 911, if you're in a crisis, the first responder to your door might not be a firefighter, a police officer, or a paramedic. It could be an Albuquerque Community Safety responder. What's the difference? There is a big difference, and we're going to talk about this relatively new department that we have. It's on equal par with the police department, the fire department. Now we have the Albuquerque Community Safety Department, and it could be a model for other departments across the nation. Please stay with us as we talk to the director, Mariela Ruiz Angel. She's been the director. It's been here in the city of Albuquerque since September. We're going to find out how it's going, how it's working, and what kind of crises this department is responding to. You might just be surprised. It takes a lot of pressure off of our police officers and off of our firefighters because we have mental health professionals addressing a lot of the problems with mental health, with homelessness, and other issues that really don't need the police or the fire department. So we'll be back with Mariela right after this as we discuss this Albuquerque Community Safety Department, a model for others. Stay with us.
The National Education Association of New Mexico, a union of teachers and school staff, believes every child deserves to learn at a school that inspires their imagination, cultivates their curiosity, and ensures a fulfilling life. Public schools should provide all our students with small class sizes and one-on-one attention. NEA New Mexico asks you to join us so together we can end the teacher and staff shortage and invest in our public education system once and for all. Sponsored by NEA New Mexico.
I've got Mariela Ruiz Angel. She's not a chief, as we think of fire chief, we think of police chief, but she is a director of the department, Albuquerque Community Safety Department, which is on par with the police and with the fire department, right there under the mayor.
Yep.
Mariela, what do you think about that?
Yeah, no, thank you for having me. I mean, you know, we wanted to make this equal to police and fire. It's important. It's a third branch, a third response to public safety, and that means it needs to have counterparts right at the equal place. You know, I meet with the chiefs and we discuss public safety, that this is really about expanding the public safety system.
And I've mentioned to you during the break, why didn't we do this sooner? In terms of not every 911 call needs a fire person come,
yep,
or a police officers. There's a lot of crises out there that we don't need these folks. They can go handle the crime that we have in the city. We have a lot of other issues, though, that are crises that need someone, and that's where you come in.
Yes.
So tell us about the department and what you do.
So in June of 2020, the mayor decided that we were going to jump in with both feet and create a new department. We had programs in the past that were social workers with police officers and different types of co-response models that were really successful, but just not really large enough to make the impact that we knew we really needed to make. And so it was during this time that we said, let's create something big and bold and new, and that's what we did. We created a new department. We spent 6 months talking to community, talking to people with lived experience, people who were living on the streets, hospitals, police officers, firefighters. What should this new department really be doing? And after about 6 months, we decided on a path, a model, and designed it and kept going, and then we launched in September of 2021. So not even a full year. We have seen amazing results. We go out to different types of calls. Yes, one of our big one is unsheltered individual, but we've also seen an uptick in unsheltered individuals over the pandemic. We saw people who were forced out of apartments, weren't able to make rent, living in their cars, living in the streets.
So in those cases, who would be calling you? The unsheltered, or I would call homeless person, or the person who sees the homeless person in their neighborhood?
Both. We get both. We see the bystanders who say, hey, I think somebody's living in their car, right? The neighbor, or the person walking down the street, or the business owner. And then sometimes it's the mom who says, I have a daughter who's in crisis and we don't know quite what to do with her. She also has a mental behavioral health issue, or she has an addiction, and we're really concerned about her. So we get the calls from all kinds of folks.
But homelessness or unsheltered people would be, at this point in your experience,
Yep.
one of the major calls handled by this new department.
Absolutely.
So when somebody calls, the mother concerned about her daughter, 911, she says, I have a crisis, my daughter has an addiction, mental health problem, where do I turn to? Do they think they're going to get a police officer coming out at that point?
They might. They might be wondering what kind of response they're going to get. It's at this point that our call takers and dispatch crew will then kind of screen, right, decipher, is this a violent call? Do we need to send a police officer? Is there a medical condition or something that we need to address? Should we send paramedics? If those don't really exist, right, there's not a huge need for police, we're going to go ahead and send ACS out. And they'll let them know. We're going to send out a behavioral health responder to go and address and see what we can do. And then we'll go out there, and even if maybe the daughter's not there, we'll go and talk to the mother, then ask questions. Where could we find your daughter? What other things should we be considering when we talk to her, right? Has there been other trauma that maybe we should know about? And then how can we help that mother who also might be in distress, right? Because who wants to see their child living on the streets? To then say, what can we do to support you, and anything that you might need. So it's really about addressing the individual in crisis, the person, right, the support system that might also be going through crisis, and even a community level, right? A lot of times these neighbors know about stuff that's happening in their neighborhoods, right? And it can be a lot of trauma for neighbors to not know, do I go over there? Do I,
Ooh,
right? What do I do? And so we'll get calls from neighbors, and we'll work with them to say, thank you so much for calling, right? What else, what any information you can help provide to us. So it's definitely been a really great, for us, we've had a lot of success in being able to build that rapport with community members and neighborhoods. But we also go to a lot of other calls. We go to calls around welfare checks, right? My mother's not answering her phone, and I haven't heard from her in 2 days.
And before, we used to send police officers to do this.
All of the calls we would go to, that we go to now, would have been calls for police officers to go out to. Because when you call 911, we have to send a responder. It's not a choice. We have to go. So now we don't have to burden police. A lot of these calls that we take normally would sit in a queue, right, a list, for about an hour and a half to 2 hours. Because we, just like you said, we have a lot of crime we have to solve. We have a lot of much higher type of traumatic incidents happening where police really need to be at those types of
So
calls.
the welfare check call might be delayed.
Would get delayed 2 hours. And that could be your mother or your father or your loved one, missing or lying on the floor or, right, just in distress. And so this really allows for us to go out. And then let's say we did go out to that welfare check of the missing mother who hasn't been, and we find that she's okay. That's a very nice call that we've been able to help a daughter or a son reach their family member. But let's say we go out there and we don't hear from her. But we see, I'll give you an instance. We went to a call recently and we saw legs from the window. We could see that somebody was in there on the floor in distress. We were then able to immediately call paramedics to come over. They were able to break the door in, and they had found this woman who unfortunately had been deceased. But it was a call that police didn't have to go out to, and it was a call that we could then work with now our client became the daughter who had called on her mother, who then we were able to say, we did find her, and how can we help, right? Is there funeral services that you'd like assisted? Is there grievance services that you'd like to take advantage of that we can connect you with? What can we do to help you at that moment? And even going forward. So it is a little bit of a shift. I think the big part about this department is that I think we've now, right, early on, we didn't know if police and fire would buy in. You know, there's a little bit of fear. Is this going to create more work for us? Are we going to have to save the social workers and the behavioral health responders because they're in bad situations? I would say that I think in all of our calls, we only have a handful that we actually, out of over 7,000 calls that we've been out to since September, I could say that maybe less than 1% have we had to call police for backup.
What? But some of the cases you send a social worker, a Albuquerque community safety responder, and a police officer at the same time.
Absolutely. There are calls like that all the time.
Give us an example of that.
For example, the most recent situation we had with the suicide at the bridge. We had a man who jumped off, and that was a social worker and a police officer. Interesting enough, that was a man who we had worked with in the past, and it was one of those situations. It impacted all of us pretty tragically, just because we hope that we can get to people before they get to that point, but sometimes you can't. And but that's the kind of call, right? Somebody who's at a higher level acuity in regards to their mental status. So somebody who's not necessarily thinking about suicide, but already in process of potentially committing suicide, would be a call for our co-response model, which is a clinician and a police officer. And we go to those kind of calls all the time. But again, we have levels of intensity of a call that we can then call each other for either saying, I need a higher level person or I need a lower level person.
Who determines that? The operator, the 911 operator would determine?
911
But
dispatch.
only a handful of times a clinician would go out and then they would say, oh, I need a little. So they kind of identified it pretty well at the dispatch to decide
yes,
where to send people.
they're doing a fantastic job, and I don't think we give those folks enough credit, because at the end of the day, those are our gatekeepers, right? Those are really the ones keeping us safe and assessing the situation. But then there's that second level, right? We've got a CAD system, which is our database system that would show us what kind of history we might be walking into. Mm-hmm. Have we been out to the call before? So all of that information also allows us to see what we're about to walk into. And then there's the third assessment, which is we get to the call and we think, okay, we're walking in and we hear crashing windows, and we're probably not going to walk into that. We're going to say, hey, we need police backup for this. This is something else going on, not the calm welfare that we thought we were going to come to. But it allows for us to address and escalate calls much faster, right? Because we're out there within 30 minutes is what our call frame is taking. From the time we get the call to the time we get there, it's about 30 minutes. And then we can escalate those so that if it is a higher level crisis, it's not sitting for 2 hours getting worse until a police officer can get out there. But we can assess it and say, yes, we need an officer out immediately, or no, we've cleared this call, we're good to go, let's move on with our day.
You're on par, again, your department, with the Albuquerque Police Department and the Albuquerque Fire Department. Budget-wise and employee-wise, how many police officers do we have, how many firefighters, and how many Albuquerque community safety responders do we have?
So we have about 800 to 900 police officers and about, I believe, 700 to 800 firefighters. And that's that. I think fire is about fully staffed in the sense that, I think there's always some vacancies. And then police are definitely still in their same kind of area where they're struggling to hire right now. ACS this last fiscal year had 58 employees, about 60. And we are asking for double our fleet in the new fiscal year. So we're asking for just about double our budget. It's still only about $15.2 million. So a very small percentage of the 250,000 that 50 million that police get. But
how much do they get? 50? About 50 million?
No, they get about over $200 million.
And yours is 15.
Mine's 15
okay.
mil.
Okay.
So again, a newer program, and a big thing is, we judge based on what we can handle in regards to where the program's at. So we, as somebody who has a background in management and program development, I didn't want to take on more than I could chew. I think the idea is let's get so many people, we can get them going. We have to consider that there's, a growth trajectory that we're trying to hit. We also have to consider training and, quality control, like, are we really, or is everybody safe? Are we using protocols correctly? Do we need to adjust protocols? So what we really felt was a double percentage of where we're at would help us get to that 24/7, because crises don't happen, right? Police officers are around 24/7 and they need support 24/7. So we'd like to get to that 24/7 number.
But you're not 24/7 now.
Not now. Right now we're 7 to 8 p.m. and we'll be extending a little bit out, a couple hours out over the next couple months, but not to that 24/7 number that we really need to get. And then we'd like to really try to concentrate on certain areas of town where we see high levels of calls for service. And I think that's really going to hopefully help with concentrated effort in areas, right, that helps us have better relationships with, one, our police and fire who are there, but two, business owners, neighborhoods, local restaurants, people who go to the park, neighbors, the community, all the neighborhood associations in those areas. It helps us build a relationship so that hopefully we can build trust and people recognize faces and that it feels like we have some stake in that community, versus being citywide where it really is difficult to try to make that, go to all the neighborhood association meetings and focus on being able to really take the time to, go get coffee with somebody. It works well, and we've seen police and fire do a fantastic job of this, right? They very strategically put command areas, so that they could build those relationships well with those neighborhoods.
Most of your employees are social workers, psychologists?
We have social
Mariela?
workers, counselors, clinicians. We also have some teachers, like people who went to school for social work but decided to be teachers. And when you think about the kind of crisis that we're going to, it really is around de-escalation. It's really about assessing and addressing the issue at hand. And I will say, in credit to our teachers, some of them do this very, very well as, working with teenagers and young kids and parents.
It's easier out there than the jungle of the classroom.
So
we
have teachers who have come over. We've had nurses who have worked the ERs. So we've got a lot of different folks, and we train up very, very much. We spend about 300 hours, a little bit less, on training, very specific to behavioral and mental health, very specific, right? Very different than the training that like police and fire have, which is it is de-escalation, but knowing that there's always a gun and a badge is very different, knowing that you don't have any weapons or any tools to defend yourself other than your voice, how you stand, your tone, your body language. All of that matters when you're needing to get out of a situation.
So Mariela, you're not allowed, the responders with the Albuquerque Community Safety Program are not allowed to have weapons?
They are not armed, so they have no batons, no pepper spray.
No,
nothing.
No.
Nothing.
How was that decision made?
Well, we heard really loudly from community that that wasn't something that they wanted to have as alternative responders. And so we decided to see what that would look like. I mean, again, I knock on wood. I know that at some point we know that somebody may get hurt in the line, and that's why we really consider ourselves first responder. We can't control every situation, and we know that. But we've taken the precautions, we've taken the protocols, we have the good training so that folks know how to get out, and more importantly, when to not even go in when they think that there might be something else going on. So I think that's a big difference than where our law enforcement, that's their job, is to walk into those situations. Yeah. And for fire, that's their job, is to walk into fires. So I think our big piece is it's really about the right response at the right time. And sometimes we go to the wrong calls, and so we'll come out and we'll get the right response out there.
A big part of your program, I believe, Mariela Ruiz-Angel, is getting them services. You go to de-escalate a crisis if it's dealing with mental health. But then also, I believe, a big part is sharing with them what community programs are available.
Absolutely. So we know that we have amazing nonprofits and work that's been happening out in the community, including our hospitals and our county services that are offered. And so it's important for us to know what each of those services does, what each of the requirements is, how we evaluate somebody to make sure that they would get into those services. And even when we do that, we still are in an interesting place where we're seeing gaps, where we're just not hitting the mark and we have nowhere to take people. Hotel vouchers are pretty low when we talk about trying to get somebody into emergency like housing or shelters or voucher, motels. We've done a great job of really getting wellness hotels. The county and the city have done that really well, but they're at capacity. So it really thinks, not to.
Are you able to transport them?
We do transport,
You do transport.
not forced transport. Somebody has to be willing to get into our car and be willing to put their belongings in our trunk. So we won't let them have their stuff in the back seat with them, and that's just a safety protocol. And but yes, we do transport. We don't normally transport two people together. Like if we had a pair, we would get two different and two different. So lots of safety piece protocols, right? But yes, we do transport, and we make sure. A lot of times it's to providers. Sometimes it's to hospitals, to the West Side shelter. We take a lot of people to the shelters, which that gives a little bit of hope that people are wanting to get off the streets.
So really, what percentage of the calls do you believe are about homelessness or unsheltered people?
I would say more than 50%.
More than 50, okay. And we've seen them on the streets of Albuquerque. Some want to stay on the streets, but you're able to help those who don't want to stay on the streets.
Yes. And sometimes, we have rapport with a lot of them. I think this whole year has been about rapport, right? A lot of people don't have the trust with police and fire. And that's not because of bad police officers or good police officers. That's just because of stigmas that have been evolved over time. And so people sometimes they want to be left alone, but sometimes you catch the person on the day that they've hit rock bottom or the day that they've said enough is enough or I'm just tired of this life, and then they do want to go into detox and they want to get services. I think a lot of us who have had family with mental behavioral health or addiction issues always hope for that day. And we're just hoping to be that person, that team, that entity that catches them when they're ready and is able to get them to. We even get calls sometimes from parents, and I hate to say this, who are just like, I know my daughter is living on the street and I wish that she would come home, but I don't know if she's alive. I don't know if she's okay. If you see her, we just see if she'd call home. And every once in a while, we'll bump into that person and just say, hey, your mom's looking for you. Can you just give her a call, or can we call her and tell her you're okay? And I know that's not some crisis derailed and that we've solved world peace, but for that mom, that's a peace of mind.
Mom or dad.
Mom or dad.
In addition to the homelessness, unsheltered people, what kind of mental health, and in addition to the crises of potential suicide, what other type of behavior, maybe someone with a mental health breakdown is being abusive, but then I imagine a police officer would join you at that point.
Yeah, so someone's already highly escalated to where they're violent. A lot of times, if they're breaking the law, absolutely we'll need to call police. But if it's something like, if they're not able to be de-escalated, sometimes it is just like, we need a break. So let's just give them some space. We're going to do a follow-up with you tomorrow and see if you're in a better space, and we'll check back in. So I think that's where we try to really gauge that sometimes people's episodes, either because they're off their medication or they have too much medication, are just not in the right mental state, especially if they're inebriated. We get calls and says this person, if we can catch them at different times, we have a different outcome.
And what other addiction type of incidences do you go to?
We do see, addiction-wise, we have the gamut. Unfortunately, we're now seeing an uptick in fentanyl, but heroin and meth are still highly the big numbers that we see. Obviously, alcohol. But we also bump into people who have gambling addictions, where we're like, what's going on? And we'll find out that they are getting SSI, Social Security, and veterans, and all the kinds of benefits. So they make enough money to have an apartment, but they're spending most of it on gambling. And so for us, it's really trying to address what's going on, right?
Case, would that be a family member perhaps calling about their concern of?
Surprisingly, it's just sometimes we bump into people on the street. And so we'll work with them to say, one, let's address the addiction. But two, because you have all these services, let's talk about how can we help you get into a place where, if we see you every first, could we help you get into an apartment that then you say, I'm going to put $600, and then we decide on how. But we got to address the underlying issue, which is where the money is going at the end.
Sometimes
of the
do you
day.
feel, Mariela Ruiz-Angel, director of the Albuquerque Community Safety Department, that some of these issues are really family related? Maybe the family should be taking care of these issues of mental health and homelessness and things rather than the city government?
I wish it was that easy. A lot of times, these are issues that the family themselves are dealing with. Addiction isn't just always something that just happens. Sometimes it's learned. Sometimes you have family or parents or grandparents or aunts or uncles that also have had traumatic issues that have led to alcoholism or drug addiction. That's the cycle that we see sometimes. It's from generation to generation to generation, and trying to break that cycle is really difficult. So as much as I think we would love to say, hey, it's the family's responsibility, I know families who would love to take on that responsibility, but for whatever reason, whatever's going on, that person just does not want any part of that. And maybe it's guilt. We see that a lot, right? I don't want my family to deal with my issues. They already have too much going on. I mean, it's such a complex issue.
But I mean, it seems like a lot with these social workers or their own private doctor. It just seems like some of these issues the family should be getting involved rather than
if it's safe, and those are the things we have to consider. Is that, like, we don't always know the big picture. If somebody doesn't want to go home, we can't assume it's because they are choosing not to. But
sounds
maybe
like there's a lot of follow-up with your program.
It is. We do a lot of follow-up, and we do as much as we can. We're not traditional social workers. We don't take long-term cases, right? And that's why we really refer to the program as a first responder. What we didn't want to do was compete with our nonprofits and our already existing programs who do fantastic long-term service connectivity to different providers and work that needs to happen.
But you mainly introduce them to this.
But we want to have a good relation. We want to introduce them. We want to do the warm transfer. So we even collect data that's like, did we give them resources, or did we take them to a resource, so that we can really even separate that type of, what's really outcomes when we're talking about.
Mariela Ruiz-Angel, we only have a minute left.
Oh, God.
Anything else you'd
How
like
fast?
to share about the past?
No, I think the big question is, we're a brand new program. We're not even a year old. We hope that we can grow. We hope that we can see good outcomes. We hope that we can be a part of the solution.
Fantastic.
Thank you.
That would make us a safer community and a happier community. And knowing that there are some social workers and others like you out there willing to lend a helping hand, and I guess required to, if we dial 911, required to follow up and do that. So pleased to have you on the program, the director of the Albuquerque Community Safety Program Department.
Thank you.
Thank you for watching the program. I am Diane Kinderwater. We hope you make it a wonderful week with your family, and we'll see you next time. And hopefully you have her back to give us an update in a year or two to see this model program for the nation. Thanks for watching. We'll see you next time. Bye-bye.
In the Army National Guard, family means everything.
Our parents, they were really supportive that all 5 of us would join. I got my education because of the Guard. I got to travel a little bit and experience a whole different culture. It helped me get my job, helped me pay for my house. Being part-time really helped because I could have some opportunities that were still in education.
Serving part-time in the Army National Guard instills pride that you and your family will share. Visit NationalGuard.com to learn more about part-time service.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program or to purchase a copy of any Issues and Answers program, visit sunbroadcasting.org or call us at 505-345-1991.